Concussions really have become a very topical subject. Fortunately, the majority of children do tolerate a single concussion well, go back to usual activities, and for the most part, do not have any lingering side effects. However, exceptions do occur. For reasons that we don't quite understand, multiple concussions have a exponentially accumulative effect. In other words, 1 and 1 does not make 2. 1 and 1 makes 20. The newer guidelines goes away from that didactic set, keep them out of play timetable, but rather individualizes the return to play guidelines based on the child's recovery.
You know that concussions are the most common neurologic injury in sports. It's not the only one. You know, kids that suffer traumatic brain injuries, whether it's on the football field or in some other venue, they can definitely suffer other problems in the brain. They can have bleeding in the brain. They can have skull fractures. They can have just swelling in the brain.
We then treat the concussion with the first step is cognitive rest to give them a little bit of time to let the brain heal. The primary goal of cognitive rest is to limit the brain activity and to not overstimulate.
For example, things such as staring at screens, watching TV, doing texting and tweeting, and playing video games, and even watching action-packed TV shows or movies can all be detrimental to the brain. So they need to really minimize their screen activity, minimize their cognitive stress at home as well during these early stages of concussion recovery. The
cognitive rest goes hand in hand with the physical rest that's going on. In sports injuries with return to play, they're coordinated on kind of a same schedule. The research shows that the week after the concussion, that child is at risk if they were to have a second concussion. And the cumulative effects of a concussion are important, and the education is very, very important to parents during that initial visit, that they need to stay out until those cognitive symptoms are gone, or at least a week's time. If you have an uncomplicated concussion that the symptoms go away after a day after, we will transition them back quicker. And that in many cases, that's the norm. It's the complicated concussions, or the ones that have had multiple concussions, that are more at risk. So we may start with a half day or a quarter day, and then gradually build them up to a full day back of school at the same time that we're doing rest. They may modify their school day, such as go to core classes only. They may modify their math class. They may go to 15 to 20 minutes of math, and that's it. Then go to the school nurse and rest during the second half of the period then. The teachers can also prepare pre-printed class notes, so the kids don't have to sit there and listen and try to copy down everything that they hear. They can just listen and absorb, and then be given the class notes at the end of the day then. So basically, the school needs to be aware of these guidelines, and they need to do their part in making sure there are academic modifications available for these students then. When the kids feel even better than that, then their symptoms have pretty much resolved, then it's okay to reintroduce a full workload, full school day, where they resume all their classes and start returning to their makeup work. They need to be cautious to try to not make up everything all at once then, because that's just going to overload the brain and increase risk if the symptoms come back. So there needs to be some kind of a program where the kids can slowly make up that work that they missed. And then lastly, during the final stages, when they're completely symptom-free and they seem to have resumed a full school day, they're making up their makeup work, then we let them resume the full academic day in school without restrictions, and also full family activities at home. It's up to the parents to go to the school and let them know what needs to be done. We can provide letters, we can provide toolkits for the schools to try to educate them, but ultimately they need to educate themselves. In some cases, we may look at a 504 plan, which is identifying the student in school and working with the teachers to enable the child to slowly make a gradual return. This will include no tests for usually a week after the concussion, but we do try and get the child back to school as quick as possible.
Another big question that the student athletes have is, when can I return to sports? And very similar to the stages of cognitive rest, the stages of physical rest parallel that. There's 7 of them, and they're all outlined pretty specifically in the concussion toolkit. The first stage is very similar to the cognitive rest. It's complete rest. Again, because of that metabolic crisis going on in the brain doesn't need to be even on the field just watching practice, just being out there in the sunshine, the coaches yelling, the team screaming, and just all that commotion might be too stressful for the concussed brain. So avoidance of that with complete physical rest and cognitive rest at home is stage 1. Once the kids start feeling better, then it's okay to engage in some light aerobic activity. If they tolerate that and their symptoms don't worsen, well, then the next stage or the next day would be stage 3, which is moderate aerobic activity. That might involve 20-30 minutes of jogging, riding on a stationary bike, developing a little sweat on your brow. Stage 4 is we pick it up a little bit. It might get your heart rate up to 60 to 80% maximum. They may run or jog or get on a bike for 45 minutes to an hour. If they tolerate that just fine, then they can go to step 5 if they don't have worsening symptoms, and then they go into more specific light contact training drills, where if they play a contact sport like football, they may put the helmet and the pads on, but hit things that don't hit back, so they can always control the degree of the impact. If they tolerate that and their symptoms remain absent and they don't get worse, well, then they move on to stage 6, which is a full practice in a controlled setting. And then finally, if they tolerate that, their symptoms are completely absent, they've resumed a full school day, their neurocognitive testing is back to normal, and they've been cleared by a physician, then it's okay to return them to stage 7, which is the final stage, which is return to normal gameplay, again with frequent reassessments, always watching for return of symptoms for these kids.
But the key point is that the patient should be slowly advanced, the key word being slowly, advanced from stage 1 to stage 2 to stage 3, etc., at a minimum of 1 day at a time, as long as they remain asymptomatic.
The concussion teaching sheets are very, very important in the initial consultation with patients, primarily because it boils down all the important information into what needs to be reviewed with the parents and the patient at the time that they come into the office, but more importantly, that they can take it home and review it with the school or significant others or their family, because there will be questions that come up.